Welcome to The Advocates. I'm Aaron Dean. Faculty and alumni are coming to the defense of Harvard President Claudine Gay. Now, the university's highest governing body, the Harvard Corporation, has said that she will remain at the helm of the university. The board said that it believes Gay is the right leader to help the community heal. Harvard leaders have faced calls to fire Gay after a congressional hearing about anti-Semitism on campus. At the time, Gay and other university presidents failed to explicitly say that calls for the genocide of Jews qualify as bullying and harassment on campuses. Now, Gay is the first person of color and the first black woman to serve as Harvard's president. As the Israel-Hamas War enters its third month, reports of anti-Semitism and Islamophobia are rising across the United States. Yale University is another school responding to hate on campus. The Advocate Channel's Gloria Pazmino has more.
We won't stand for it, we won't tolerate it, and we come together to condemn it yet again today.
This scene is the latest example of the anti-Semitic incidents spreading across college campuses in the U.S. Yale issued a statement Sunday condemning a video showing a person wearing a traditional Palestinian scarf, climbing the menorah, and hanging a Palestinian flag from it.
I have heard from students saying they're moving out of dorms. They're thinking of transferring schools because they don't feel safe.
It's not just students. Leaders of some of America's most prestigious universities are also facing scrutiny. The president of the University of Pennsylvania stepped down from the Ivy League school following a storm of criticism after a congressional hearing about anti-Semitism and hate on college campuses.
I've heard that thoughtless, reckless, and hateful language on our campus.
Harvard President Claudine Gay has apologized for her remarks and remains in her post despite calls for her removal. On the other hand, Gay has more than 600 signatures in support from faculty members.
Anti-Semitism is very real. We've been seeing it on college campuses across the country. We see it in rising hate crime statistics, and we can't just dismiss it.
In New York, I'm Gloria Pazmino reporting.
A new study is revealing a stark new reality for unhoused Americans. Non-elderly people experiencing homelessness are 3.5 times more likely to die than those who are housed. The National Bureau of Economic Research looked at 140,000 unhoused people. They found homelessness can essentially age you prematurely. A 40-year-old homeless person faces a similar mortality risk as a 60-year-old housed person. The authors of the study are hoping to highlight these realities while providing life-saving solutions. We're here to discuss your recent study, Life and Death at the Margins of Society. Can you share a little bit with us about how this all came to be?
Yeah, absolutely. So I think from a broader perspective, we as a nation do not have, or up until now, we have not had a comprehensive and accurate understanding of the mortality of the U.S. homeless population. And this has primarily been a data issue. It is very hard historically to study the homeless population within the USA just due to underrepresentation in data. So it is partially because of access to data that we have decided to go through with this study, in a new way by linking the 2010 decennial census to household survey data. But a large part of this is also because this project kind of falls under the umbrella of a larger thesis of research being done at the University of Chicago through the Comprehensive Income Dataset Project, which studies income inequality and homelessness in the USA.
What did the study find regarding mortality patterns among people experiencing homelessness?
Right. So we have a few main findings. I think it was well known for a long time that folks who experience homelessness have a heightened risk of mortality generally. And this study just gives a lot of strong data to back up the numbers behind this increased risk. So we find first that non-elderly people who are unhoused have a 3.5 times more likely probability to die than individuals who are housed. And this is actually quite a sheer comparison when you look at the comparison, for instance, between Black individuals and white individuals who are housed in the US. This actually exceeds that mortality gap. It's only a little bit smaller than the mortality gap between individuals who are disabled and who are not disabled within the US housed population. We also find generally that homeless individuals' mortality risk is greatest when they are in middle age, so in your 30s or your 40s. We find that, for instance, someone who's experiencing homelessness and is 40 years old has the same mortality risk as someone who is 60 years old and housed. And so you can see this like really elevated risk of mortality if you are experiencing homelessness compared to individuals who are housed.
And you kind of spoke a little bit on some of those prominent disparities. Are there any other disparities or socioeconomic factors that kind of play into these findings that you thought were like, oh wow, didn't know that, or like, okay, I figured?
Right. So I think that within the homeless population itself within the US, there are some pretty clear understandings of relative mortality risk that you would expect going in. So individuals who are already homeless, who tend to have fewer social connections that we measured, or who tend to be disabled due to using data that we have on Social Security records, or who have a history of unemployment, or who have lower incomes relative to other individuals experiencing homelessness. All of these risk factors increase your mortality risk even within the homeless population. And so there are some patterns that you would expect to see that we do see. And then there are some maybe less intuitive patterns that show up within individuals who are experiencing homelessness and their mortality that you don't actually expect to see. That surprised us a bit. One of those being, for instance, within the US housed population, Black individuals tend to have a higher mortality risk than white individuals, especially Black men. This is actually a pattern that's reversed within the homeless population.
Oh, wow. Okay. And you also found that COVID-19 played a role in the rise of homelessness. What were the unique challenges that the homeless population faced during the pandemic that contributed to this rise in mortality? I would assume, I guess if it's safe to assume, the lack of healthcare access?
Yes, I mean, that's a big one. We don't have, unfortunately, our data does not have cause of death. And so it is not clear to us. I mean, we cannot say anything about causality of what exactly is causing heightened mortality during the pandemic. But the reality is, if you are experiencing homelessness within the US during the COVID-19 pandemic, not only do you already have restricted access to healthcare just on a day-to-day basis, suddenly you also have a situation in which hospitals are overcrowded, in which emergency services that normally individuals who are experiencing homelessness tend to use, that's their usually first line of medical care, is an emergency service. These are overwhelmed with COVID-19 patients. And so it is a combination, likely, we suspect, of actual COVID-19 deaths and lack of care, but also perhaps medical issues unrelated to COVID-19, but due to hospital inundation, folks are unable to get the care they need.
And can understanding these patterns and this data, can it help inform targeted advocacy or policies to address these health disparities amongst the homeless community?
Yeah, I think that, I mean, there are always policy implications, especially with something as pressing as heightened mortality. I think the fact of the matter is mortality is a very stark measure of well-being, right? It is a rather unequivocal measure of not only someone's health and well-being, but also their stability within life. And the very fact of having such a heightened mortality risk within this population just leads directly to the sense of what are the policy solutions that could perhaps mitigate this? Is this a mortality that is as a result of being homeless? E.g., does entering into homelessness predispose you to higher mortality risk? Or is this another way around, that people who are already predisposed to higher mortality risk also are predisposed to other factors that make folks homeless? And so I think that is where the best policy advocacy will go, is to try to parse out what are the things in there that might be the best kind of mitigating factor. I think another interesting thing that we find is that, interestingly, unsheltered and sheltered individuals, so people who are homeless and are primarily within homeless shelters, and people who are otherwise primarily on the streets, don't seem to have a substantially different mortality risk. And so this does also have an interesting kind of policy implication of whether funding shelters is enough in kind of mitigating this risk, or if there's something underlying the general experience of homelessness that needs to be targeted.
Thanks so much for watching The Advocates. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe to our YouTube channel. For The Advocate channel, I'm Aaron Dean.